Well, welcome to Better Black Health with Dr. Greg Hall. Here today, really on behalf of Sequence Multivitamins for African American men, women over 50, men and women under 50, and men and women over 50. Sequence Multivitamins tailored specifically for African Americans. But today we have a wonderful treat. We've got a plastic surgeon from California, Dr. Dr. Stephen Williams, board certified plastic and reconstructive surgery, trained at Yale University. My goodness, undergrad at Dartmouth College. He is now the president-elect of the American Society of Plastic Surgeons, which is the first African-American president in its 92-year history, which is really just outstanding. You are representing big time from the West Coast. I'm here in Cleveland. We're going to talk all things plastic surgery. So first off, tell me about the Brazilian butt lift and how many requests do you get for those? My patients are going crazy doing those.
Yeah. So, Brazilian butt lift is the colloquial name for liposuction and fat transfer. And so it really refers to taking fat from the abdomen, the flanks, the back, really anywhere where patients don't want it, and recycling it. And that's, again, as a plastic surgeon, that's kind of what we do. We love repurposing things that people don't want into things that they need or want. And so we harvest living fat cells and we re-inject them in a special technique that allows those fat cells to survive in the areas we transfer them to. And BBL is an amazing surgery that's been around again for a decade or so. It got a little bit of a bad name for the last couple of years because we were really noticing that there was a little bit of an increase in very serious complications, including death, which, again, we're doctors first and foremost. We want to make sure our patients are doing well. The ASPS and other groups really took some time to look at what was causing that and made a lot of educational recommendations to plastic surgeons. And now that surgery is safer than things like tummy tucks and things like that. And so It's kind of on the radar as a safe thing for patients.
My patients were leaving the country to get Brazilian butt lifts. And I mean, just because it's called Brazilian butt lift doesn't mean you should go to Brazil to get it. And I always thought it's crazy to leave the United States to get health care. I mean, am I just being, American centric or is it crazy to leave United States to get health care?
I think it's okay to be American-centric, but it's like everything else. It's a complicated question. Mm-hmm. There are some access issues and cost issues that tend to drive people to other locations, and I certainly understand. And it's not just cosmetic surgery; it can be reconstructive surgery as well too. And there are certainly doctors in other countries that do good, safe procedures. The challenge is, how does a patient identify who the good ones are and who the good ones aren't? And moreover, if you're physically traveling for a certain procedure, who's managing the post-op care? Who's managing any complications? A lot of times, even if you're going to a good surgeon somewhere in another country, that post-op care isn't as good as you need it to be. And that's really the issue.
And that's controlling infections and deep vein thrombosis, and just being smart about that, because that's when you get stuck. I mean, I've had friends who had relatives need IV antibiotics, and we've had to try to ship it to South America because they didn't have like Cipro IV. You know what I mean? It's just crazy. So if you get some kind of an infection somewhere and you're not able to get get what you need or get the care you need or the intervention you need, that can be a big deal.
Yeah. And, then as you're a physician, I'm a physician. One of the things that's challenging as a physician is the medical legal environment in the United States is really aggressive, and we're really held to an incredibly challenging standard. The good thing about that is it means we're held to an incredibly challenging standard. For patients, that's a real benefit. Again, I'm not saying that there aren't good surgeons in other places, but there are very few places similar to the U.S. in terms of how much burden of producing good, safe, quality healthcare results that we're held to.
Right. So back on the Brazilian butt lift, I've seen some dramatic outcomes that I think look a little crazy. Maybe that's me, but something about the butt tapering into the thighs. I mean, do you guys look at that and how, so it doesn't look like they had a Brazilian butt lift? I mean, or is that what they're looking for?
Yeah, as again, being a good plastic surgeon, one of the first things we want to do is listen to what patients care about and what's bothering them, and find safe ways to achieve what they want.
Mm.
I will say that as this operation has evolved, natural things tend to be more popular. And so patients are now saying, you know what, I don't want to look like a cartoon. I really want some balance. I really want to try to just, restore some of this volume or some of this curve. And that's been something that's been really, really great to kind of see less of those kind of the crazier operations. Again, we want people to be able to fulfill their goals and desires as long as it's safe. We want the outside to match the inside as much as we can get people there safely.
Mm-hmm.
But I would definitely say we're seeing more and more of people say, you know what, I don't want to go too crazy. I'm looking for something that looks natural.
Right. I think that's kind of what you always want. Do you notice that that people are going too far in terms of how small they want their waist? Do you see that at all, or can you have a waist that's too small?
Well, it all depends on what you're looking for. There's certainly been a history of people removing ribs and things like that to try to achieve cosmetic goals. I don't particularly do those operations. I try to discourage patients for them because it's always a little bit of a risk-benefit analysis.
Mm-hmm.
How much are you willing to put your body through for this idealized look, and what's really motivating you? And I think that's one of the things that, again, has gotten better with time, but we always have to kind of remind patients about it's your body. We have to consider your health first. And what are your real goals? What's really important to you?
Mm-hmm. Right. And what's the impact of fads? Like, is this Brazilian butt lift, is it a fad, or is it here to stay, or what do you think?
Greg, you're asking all the right questions. And so I think that, interestingly enough, fads and trends, especially in plastic surgery, have been around for a really long time. It's not something that's new. What is a little bit new is social media has just poured gasoline on them. And so it's the combination of social media's ability to spread that message really, really quickly, but also social media in some ways setting the standard for how people should look and feel about themselves.
Mm-hmm.
Those two things together have really intensified some of these fads and some of the things we're seeing. And so for us, it's not about us being paternalistic or telling patients what they should or shouldn't want or what they should or shouldn't find beautiful.
Mm-hmm.
But it is a little bit of our obligation to remind patients that Instagram isn't always real, and what you're seeing online isn't always the goal you should be striving for.
Right. We had a recent episode that talked about multi-generational trauma. And as part of that, we talked about, things that, the little girls had picked the white doll over the little black girls that picked the white doll over the black doll, or we talked about me and you. It looks like having good hair, versus bad hair. And I said how annoyed I was to say someone said I had good hair. You know what I mean? Because it's just I have different hair, right? But that's something that what's bad is associated with being African American, and what's good is associated with being white. And so when you see, God bless them, the Jackson family, going with the noses, which is clearly a European nose against, the original nose that my wife swears if she hadn't married me, she was going to marry Michael Jackson. So, when he was 11 or 12, you know what I mean?
She made the right choice.
When she grew up, but she liked his own nose. You know what I mean? She liked the nose that we recognize as an African American nose. You know what I mean? But people ask for a transformation in some cases to a more European look. Do you see that? African American specifically, or?
It's not just African Americans. It's really all races. There's the Asian blepharoplasty. There's the African American nose. There's kind of all of these, different things where people are trying in some ways to walk away from things that may identify them ethnically.
So you said the Asian blepharoplasty. What's that?
Yeah. So some people of Asian descent are missing a fold or second, kind of this double lid, this fold within the crease. And so there's an
their eyes. Oh, uh-huh.
That's right. So there's an entire industry to create that fold.
Get out of here.
Yeah. And so it's not just, it's not just people who look like me and you. It's kind of endemic. And in some ways, people could argue that the Brazilian butt lift is a reverse of that. The Brazilian butt lift is maybe more Northern European trying to look more ethnic,
Right.
more like indigenous Brazilians or like Africans. And so
With the lip injections, they've got those as well, right?
Right.
Where they're making their lips bigger. That's not Eurocentric for sure.
And so it definitely is penetrating kind of all levels. The thing for us, number one, I think we're seeing people being more sensitive about it, patients and physicians. Physicians are recognizing and listening to patients more, which is always a positive thing.
Mm-hmm.
And we're seeing, when I have patients come into my office, and if it's an African American patient who's looking for a rhinoplasty, I'm hearing more and more commonly, I don't want to look not like me.
Mm-hmm.
And most of the time when we dive a little bit deeper, what they're saying is, I don't want you to try to erase my ethnicity or try to erase some of the features that identify, that make me look like me.
Right.
And that's really refreshing to hear. And those conversations, I think, in some ways are a little bit newer in plastic surgery. And I really, really encourage them, because it's not necessarily about good hair, bad hair, or, what kind of nose should you have? Did Michael Jackson go too far? I mean, I think most of us agree that Michael Jackson went too far.
Right. Right.
It is thinking a European, a Northern European style nose, is that wrong? No, it's not necessarily wrong, but it's important to recognize, is that the right thing for you? And where does some of that desire come from? And so we're having more and more in-depth conversations with patients, and kind of helping them to explore those issues so that they're able to make the right decisions.
Right, right. What about people who said plastic surgery is addictive? You know what I mean? They have one and then they go crazy. Is that just because the outcome, they're just really satisfied with the outcome and then they pick something else? Or is it, they say tattoos are addictive too? You know what I mean? But I don't know. Is it along those same lines?
It's a good question. I think it can come from multiple places. I think in the situations where people say, you know what, I really appreciated the ability to take control, and I really appreciated the ability to do something that reaffirmed who I was or what I wanted to look like. I think that I understand why people say, okay, now I'm going to do one more thing, because I really liked being able to take control back, and I really liked being able to, have that influence over my physical appearance. I think that you can also see it in a more negative way. You can also see it in a way where people say, I'm never going to be happy, and I'm just not satisfied with how I look. And this is better, but it's not enough. And I want more, and I want more. And as you know, there's actually a medical term for it, body dysmorphia, where people are just really trying to find unnatural or unrealistic ways to look that are really not achievable or come at an incredible physical cost.
Right.
Get there.
I find it that that self-esteem plays a big factor in it. And I
absolutely.
I had a patient with a huge scar. Really it was from her jaw down her neck, huge scar, and she never thought anything of it. She never thought anything of it, and she was just as proud of herself. And I always thought, my goodness, I'd be so self-conscious if I had that scar. And she wasn't. And I admired her for just, it was her. And eventually that scar fades for the people that know her. It's like, it's super obvious if you don't know her. And then as you know her, it disappears. And it's amazing that, I still see her. And I'm like, now it doesn't bother me at all. But she's never asked me, should I get this fixed? Should I, and so I wonder that people have other things that are very small and insignificant to us, but their eyes are going right to it.
Well, I think that you've really hit on the core issue. It's incredibly personal. And it's never for a physician or for a spouse or, you can't really tell people how they should feel and how they should look. And as a plastic surgeon, it's my job really to listen more than tell. And, things that are small can make really big changes to people. And, sometimes similarly, we've done something that's really a massive surgery. And I'm like, oh my gosh, this is so amazing. And the patient says, yeah, I guess it's a little bit better. And we're like, it's night and day. The change is night and day. Whereas sometimes we'll do the smallest little thing. And I think your scar example is a kind of a classic example. Do the smallest little thing. And someone will say, this has changed my life.
Right, right.
Like, that little thing? Okay. Good for you.
That's amazing. And I wondered so what's the smallest thing you did to someone that made the biggest transformation that you could see? You know what I mean? I'm doing this, but boy, that really just changed everything.
Yeah, I think a lot of times facial surgery, like, doing someone's lids or ear surgery, those types of things, sometimes that can make a really, really big change for people. And I think, again, to harken back to something that you mentioned, sometimes scars or trauma that we're making better for people, dog bites, car accidents. Part of the reason those can be so emotionally powerful is because the person didn't do anything to kind of have that associated with them. And that's not how they were born. It wasn't
Hmm.
part of their natural aging. This is something that happened to them.
Right.
And so a lot of times trying to make those things better for people can make a really positive change in their lives.
Right, right. That's great. And then you talked about big transformations. What's like the
Mhm.
most you've done? Not at one time, but I guess maybe in one person.
Yeah, we've had patients who've kind of undergone complete transformations over a period of months or years,
Mhm.
and body surgery, face surgery, and again, we approach those patients with not caution, but we really want to become partners because we don't want to just say, okay, great, next surgery. We really want to say, how did the last one affect you? How, was it a positive change? Was it what you expected? And if we're getting, reasonable answers and the patient really seems to kind of absorb that process, then we know it's safe to kind of go on to the next step.
Right, right. So we're talking to Dr. Stephen Williams from Tri Valley Plastic Surgery, located in Dublin, California. Where's Dublin near?
Yeah, Dublin's just outside of Oakland. So we're in the East Bay of San Francisco Bay Area.
So people could fly there if they wanted to. If they wanted to meet you and talk to you, would that be acceptable?
Yeah, we also do online consultations and things like that. That sometimes makes things a little bit easier.
Absolutely.
You'd be surprised what I tell a lot of my patients who want to come see me because, again, fortunately, we're blessed to have kind of a bigger name, and part of it's because I think we do good work. But I usually tell people there's a lot of good plastic surgeons everywhere in the United States, and
Mhm.
so I'm honored that people want to come see me. But sometimes I say, there's also Dr. So and so right around the corner. But we feel honored that we're a resource for patients.
But one of the things I just did a lecture on another platform on different skin presentations and skin of color,
Yeah.
psoriasis and
Yep.
atopic dermatitis. And one of the things, the number two highest diagnosis given to African American patients was non-specific dermatitis, which basically means they don't know what it was.
Right.
you know, the doctor didn't know what it was. They call it non-specific dermatitis. They probably gave you a steroid cream. And so and that was not in the top five for European descendant Americans, right? So
Isn't that interesting?
it is.
Right.
Right. That there are significant differences in the diagnosis of skin lesions in African Americans and how things present and related things. So as it relates to finding a plastic surgeon and knowing how the skin is going to heal, and are there any predilections for infections with this or that? Have you noticed any trends as far as that's concerned? When you say, rather than I could go to a dermatologist around the corner, does he need to know anything about me as an African American?
It's a great question. And, I give my colleagues a lot of credit. I think that, a well-trained plastic surgeon can take care of anyone. And while I appreciate the fact that some of my patients say, well, you're a black plastic surgeon, you're going to do a better job. I appreciate that. It's not necessarily inherently true.
Mm-hmm.
There's definitely some differences in skin. African American Asian skin tends to be a little bit thicker. It has more melanin, which is responsible for the difference in color,
Mm-hmm.
which means it's a little bit more resistant to UV radiation and damage from the sun. Our scarring tends to be a little bit more aggressive. Our scars tend to be a little bit darker and more prone to being hypertrophic, which means a little bit thicker.
Mm-hmm.
We have a higher chance of having keloid formation, which is obviously a more extreme formation of an abnormal scar. But I think the biggest difference, and I think your dermatology story kind of relates to this a little bit, our biggest difference is just taking the time. And sometimes, again, some of that outward bias and some of that, not really interacting well with a patient that maybe isn't of the same race of yours,
Mm-hmm.
sometimes that has the biggest impact. And so I think there is still something to be said for how people of color and women are treated in healthcare.
Mm-hmm.
And all you have to do is look at outcomes, just like you pointed out. Why are women's health outcomes poorer than men?
Mm-hmm. Right. Right.
There's nothing. And does that mean that every woman needs to go to a female doctor? No, but it means that we may be doing something in how we're listening, or how we're interacting, because it's not just what we take in, it's also what we put out that's critical for patient care and patient well-being.
Absolutely. Listening to them. An article just came out with JAMA that said that community counties with the highest number of Black primary care physicians for African Americans live longer in counties where there were more Black doctors. Black
Right.
patients live
Lower
longer.
mortality rates and greater longevity.
Right. So it was, and that just came out. It's in JAMA. So they're like, and that was an NIH funded study. So it really shows that Black patients do better. But like you say, the secret sauce is probably not in what they know, but in how much they listen and how much they gain, how much trust they gain, and that can make a big difference in how you do. So let me ask about men. I mean, so what percentage of your patients are women versus percent that are men?
Yeah, so our practice is primarily female patients.
Mm-hmm.
We have probably about 10 to 15% males.
Mm-hmm.
Men are generally looking for liposuction, sometimes blepharoplasties.
Mm-hmm.
They tend to not be undergoing lots of breast cases unless it's gynecomastia. So males that have kind of female like breast, we're doing some liposuction to help them, but primarily female patients.
They see, marijuana smoking or edibles or whatnot is associated with gynecomastia in men, and I've had men come and say, why do I have this going on? And I was like, well, and then I smoke weed every day. Well, that that's not helping, right? Do you see that? Do you talk about that at all?
We do. And so, causes for gynecomastia can be some rare tumors. So things that affect your male hormones, some medications, cimetidine, a couple others can definitely be associated with gynecomastia. But marijuana, especially as it becomes more legalized throughout the country, can really be an issue. And, guys are like, well, now that it's legal, I do it every day. Mm-hmm. And now I've got this. I'm like,
got D cups now, so you may want to slow down a little bit. What about cool sculpting? For the people that are trying to get their stomachs smaller, is there anything to that? I mean, and I'm not trying to.
No. So we, it's very interesting. The New York Times just had an article today or yesterday about cool sculpting, and so cool sculpting's been around for a very, very long time, and the concept is actually a process that came out from a discovery by pediatricians. Mm-hmm. And so what happened was moms would bring their kids in and they would say, little Johnny's face is asymmetric. And, for a while, pediatricians were like, well, that can happen. There can be some differences. But they noticed a pretty distinct pattern. And then someone was smart enough to say, well, tell me about the eating habits. And they started noticing that kids that would take frozen popsicles that we used to put in the freezer, pour juice in or you get from the ice cream truck, and instead of kind of either licking them or chewing them, they would put them on one side of their mouth and just let them melt. Mm. And what they noticed is the kids that did that would lose fat on that side of their face.
Wow.
So through some very careful question asking and looking at data, they discovered that if you cool fat cells down to a certain temperature, they undergo programmed cell death. So they just kind of go away. Mm. And so there became a company that built around that exact concept called Zeltique, which created cool sculpting. That company was acquired by Allergan, and Allergan was acquired by a gigantic company called AbbVie. Mm-hmm. And so cool sculpting's been around for a very, very long time. The reason the New York Times had them in the newspaper is because there's a side effect to cool sculpting where people can actually get a little bit more fat in that area. And it generally requires just a little bit of liposuction to permanently fix it. But there's some discussion about how clearly that risk was communicated by the company. And as always, there's always risks and benefits to every procedure that's done and whether those risks were clearly communicated.
Right. Wow, that's amazing. So it's like we're going to make you smaller, but you could end up getting bigger and needing liposuction. That's kind of it's hard. How do you convey that?
You just tell them risk. Now the nice thing is it's an incredibly low risk. It's 1 in 3,000, 1 in 2,000 patients, and the treatment to make it better is relatively straightforward. It's an in-office procedure to make it better. And AbbVie and Allergan have been relatively good about actually compensating patients when that
when that
happens if they
happens.
get that treatment.
So if you had somebody who had a little bit of, a spare tire, would you recommend cool sculpting versus lipo tummy tuck or
it really depends. And so cool sculpting is really more analogous to small volume liposuction because all it's dealing with is the fat. All you're taking out is that internal volume. It's not good at managing skin. Our female patients who've had babies, they have that rectus diastasis, that separation of the muscles. It's not good at fixing that.
Right.
And so it really depends on kind of what's causing that fullness. If it's just a little bit of fat, cool sculpting can be very effective. And we've used it in our office for, well over a decade. If it's multiple areas, generally it's more efficient, more cost effective for patients just to have liposuction because we can very carefully control what areas we're sculpting and making look better all in one setting.
That's cool. Let me ask you about these chemical peels for the face.
Sure.
People get excited about that. Tell me a little bit about chemical peels and
Yeah. And so chemical peels, laser resurfacing, all those types of things. The concept is you're doing damage to those top layers of the skin, allowing that skin to reepithelialize. And usually those results are lesser, fewer wrinkles, better skin texture. Sometimes the pores are smaller as well too. And so it's not specifically chemical peels. Laser can also be a very effective way at doing some of that.
Okay. All right. So that's not something you would necessarily avoid or anything like that. And then
Botox, but you have to be very careful. Again, especially people with our skin color, we have to be cognizant of the fact that sometimes we're at higher risk for hypopigmentation. We're at higher risk for hyperpigmentation when we're doing these traumatic things to our skin with, the overall goal of improvement. Sometimes you have to be a little bit careful with the skin type.
So you're saying hypopigmentation, you're saying the skin might be lighter, might come out lighter, or hyper, it might be, it might end up darker than you originally started. And how do you know in advance whether you're going to be lighter or darker or no change? You don't know.
So some of it is the modalities that we're using to try to achieve some of this. There are some lasers that have specifically are approved for kind of darker complexion people to make sure that it's safer. Same thing with some of the peels. Some of the lighter peels are safe to use. And it's really a matter of your plastic surgeon knowing the difference. And that's really the key.
How many patients do you refuse? You say, no, I'm not doing this on you.
Yeah, more than you'd think. And I never like to say refuse. What I'd like to say is not the right time right now. I think you have to be a little bit curious about a plastic surgeon says, "Oh, I operate on everybody." Because not everybody's ready for surgery. It's not the right time from a family support perspective. It's not the right time from a career perspective. It's not the right time for a health perspective. It's not the right time from an expectation perspective. I just today I had a patient come to me, and I'm not divulging anything.
Right.
But she's like, I really want a tummy tuck, but I think I'm going to have a baby again in a year and a half. I'm like, you should wait.
Yeah, that's crazy, right? Why would you even want to do that, right? I mean, it's just the baby's probably gonna throw that off again, right? You're right. It's it's like a best time. But I was and then Botox. I mean, like everyone's doing Botox.
Very popular.
What is that? I mean, there are people ask me if I want to be over a Botox. It's like, no, I don't know anything about Botox. But we just need your license, yeah, and someone to sue, right?
That's exactly right.
Right.
No, and so Botox is one of those treatments that again has become a mainstay in minimally invasive aesthetic improvement, and it's probably the poster child for, hey, I don't want a lot done, but this one thing is bothering me. And Botox essentially works by paralyzing parts of the muscles. And again, you and I, we're physicians before, at least for me, before I became a plastic surgeon, I was a physician first,
right.
and was taught about botulism and, like, oh yeah, if those cans are swollen and shaped, don't open that because it's got botulism toxin in it and you won't be able to breathe and you might die. Again, smart people said, well, what if you use just a little bit of that, just in the right spaces?
Right, right.
And it's not just to look better. People use it for people who have spastic paralysis, people who have facial paralysis, people who have migraines. Botox has become a mainstay about making those people's lives better, and it doesn't have as much to do with how they look cosmetically.
Mm-hmm.
When we think about Botox, the much more common thing that patients know is it gets rid of some of my wrinkles. And
Mm-hmm.
it does that by temporarily paralyzing some of those muscles that are responsible for those wrinkles. And because it really was one of those very early, minimally invasive, relatively low cost, relatively easy to perform surgeries, nurses do it, physician associates, assistants do it.
Mm-hmm.
You started seeing this groundswell of these med spas popping up. And in most states, not every state, but in most states, nurses and PAs still require physician supervision. And as it should be, because at some point you can still hurt people with these minimally invasive treatments. And so what you've seen is the unfortunate situation where these corporations or kind of these mid-level practitioners sometimes look for people, especially towards their retirement years, saying, look, you don't even have to come in. I just need your license and you'll be the one that orders it, but we do everything and we're going to pay you. You're going to get $10,000 a month and you don't even have to think about it.
Right. That's a setup.
Physicians should be very cautious about those types of relationships.
Yeah.
And, it's really our obligation as doctors to make sure our patients are getting good care. And what that really means is we still have to see the patients. And we still have to make sure that the people who we entrust to help do a great job. I've got amazing nurse injectors. I've got amazing PAs that work with me, but we work as a team.
That's great. That's great. So thinking ahead, now you're going to be president of this American Society for plastic surgery. What are you going to do? I mean, what mark? I mean, everybody gets to leave their mark. I would like to think, you know what I mean. And when they get an opportunity like that, what are you going to sort of put a spotlight on?
Yeah, my background is one of technology, and so I've been involved with ASPS, which, by the way, is the internationally the largest organization of certified plastic surgeons. In the United States, it's board certification. In other countries, there's an equivalency for that. But in the United States, it's 95% of the board certified plastic surgeons are part of ASPS, and it's growing internationally. It's such a great organization because it really focuses on patient education, physician education, supporting the practice, research, charitable and philanthropic efforts. It's just a great organization. I have a tech background. I had a successful tech company that I exited from, and so I've had some technology initiatives in terms of patient outreach, patient interaction.
Mm-hmm.
That I've been working on with ASPS. From a social standpoint, it's about a lot of the things I've talked about making sure that we're understanding that all patients deserve to be heard. And if we have patients that are getting outcomes that aren't great, especially women or minorities, underrepresented minorities, we should really understand and look at why that's happening. And I think plastic surgery can be the poster child for that. We're really doing, I think, a much better job recently in terms of listening to our patients and in terms of understanding barriers they have to access to care. For example, breast reconstruction is still really, really stark differences between African-American females and non-African-American females about who even gets offered breast reconstruction.
This is like after breast cancer or something like that? Yeah.
That's right.
And does it get covered by the insurance?
So there's a federal law that requires insurance companies to cover it. But for some reason, African-American women aren't told about it at the same rate as non-African-American women. And so those are things that I really want to bring a spotlight on. And again, I'm someone who really believes that things have gotten better, but we're just not there yet. We still need to continue to do work. And so when I hear someone say, "Oh, I'm just so sick of hearing about all this diversity and inclusion and equity, and it's better," I'm not racist. And so I get it.
Yeah.
Yes, things have gotten better, but we need to continue the conversation, recognizing that it's been a long history that's affected people like me, people like my parents. Those things have a long tail legacy, and it's definitely better. We're definitely going in the right direction.
But then things like that still happen, though, right? And somehow people aren't told that you could have this whole reconstruction done, right. But they just weren't. Whether the bias drove it, whatever drove it, but hopefully through a media like this, we can let people know that this is something they can really kind of put people on the spot for, because that's
100%. And I think that what's really empowering is not just the fact that physicians and societies are increasing conversations about diversity and about making sure that we're listening to patients and understanding some of the barriers to access. And again, it's not just underrepresented minorities. It's maybe people who live in rural areas. There's all sorts of things that get in the way of people's healthcare. But one of the things that's really kind of interesting is social media has a lot of bad things, but one of the things that I think it's responsible for that's positive is there's a lot of patients saying, I deserve to ask this of my healthcare provider. I deserve to be heard. And that's really great because I think that's driving things in the right direction from, that's all coming from grassroots patient motivations.
I think you're absolutely right. And people need to know that they do have a right to ask and when they have a right for us to listen and reflect back on what they're saying and try to incorporate their wishes in our treatment plan. So how much is nutrition and what you eat and exercise, how much does that figure into the healing process after surgery or even the preparation going into surgery?
As you know, it's the foundation, it's the bedrock. A lot of times nutrition problems get us to healthcare problems, especially in America. And I think, again, America has been a little bit more cognizant of it, but obesity continues to be a massive problem. I think that when we're looking at healing, it's always important to think about nutrition and environment and all those things. And so it's critical because you can't have good health without good nutrition. So
you're going to do that. You're going to make sure you're healthy going into the surgery, right? You're going to make sure you have the adequate amount. And we see, widespread vitamin D deficiency that affects wound healing, right? Vitamin C affects wound healing. What else?
Vitamin C definitely affects wound healing. Vitamin A can affect wound healing, and so all those things are things that we really tend to think about, and especially people who are, for example, taking steroids. We think about definitely some vitamin supplements because there's really good evidence that some of those vitamins at a higher level than maybe everyone else takes can reverse some of those healing challenges that we have when people have had chronic steroid exposure.
Because there are people that have some terrible diets out here, and I wish you could, eat a salad. You know what I mean? So it's important. So anyway, this is Better Black Health. We're brought to you by Genetic Sequence Multivitamins for African Americans. It has more vitamin D, more zinc, more vitamin C, magnesium, potassium, which has been shown to have deficiencies in African Americans. And so you'll want to go to sequencemultivitamins.com to take a look and see if that's something you might be interested in. We, as physicians, we always say, eat a salad, improve your diet. Don't take a vitamin instead of eating, right? Do some walking. Take a walk around the block. That helps, your breathing and your healing and all those things. Well, Dr. Stephen Williams, what a great treat to have you here today. I appreciate you coming. This has just been very educational for me, and we're just so happy to have had you. Let's see, you're at the website is, tell me about the website and where we can find you.
Sure. The website is trivalleyplasticsurgery.com. And then I'm also on social media, for better or for worse. My personal account is Surgeon in Black, which is appropriate.
Yeah, Surgeon in Black. I like that. Yeah, Men in Black, Surgeon in Black. Yeah.
So people can reach out to me. I try to be really responsive and try to be supportive of the community. So that's great.
That's great. That's great. So if you're just thinking about plastic surgery and you want to talk to an African-American plastic surgeon who's going to be the president of all plastic surgery organizations, which is just outstanding, and a Yale graduate, my goodness, just give Dr. Stephen Williams a call. For now, I'm Dr. Greg Hall. Thanks for joining us.
Dr. Hall, thank you very much. Thank you.
None of the statements that I have made have been evaluated by the Food and Drug Administration. Genetic sequence multivitamins are not intended to treat, cure, or prevent any diseases. Furthermore, none of my statements should be construed as dispensing medical advice or making claims regarding the cure or prevention of diseases. You should consult your own licensed healthcare provider before starting any supplement, diet change, or exercise program, especially if you're pregnant or have pre-existing injuries or medical conditions. Remember, having a doctor is always your best option.